Greetings. Let us talk about bougie dilators, especially those without a guide wire. So here is a bougie dilator, and these are made by different companies. Some of them have a tapered tip, others could have a blunt tip. And for bougie dilation, we need different sizes of bougies, lubricant, and a little bit of gauze. And before we go further, bougie dilators are used in the management of simple stricture or simple esophageal stricture, otherwise defined as a wide bore short stricture. And in this case, bougie works. Again, it also works in esophageal membranous webs, otherwise known as simple strictures. Again, in this condition also, the bougie dilator without the wire works. However, this is not good for a complex stricture where it should not be used. Complex stricture is a severe narrowing, long narrowing, angulated narrowing. And these types of strictures, if you use a bougie without a guide wire, the bougie is likely to coil above, and you may be thinking that you are going through some resistance, and if we push, there is a chance for perforating the esophagus. So for this reason, bougies without a guide wire are used in the management of simple strictures but not complex strictures. So when it comes to bougie dilators, we talked about some of them are taper tip, some of them are blunt tipped, and the two big names are Melanie dilators and Hurst dilators, and they come in different sizes, and we need a lubricant and we need gauze. Typically, this is how a bougie dilation is done. We lubricate the dilator tip and gently insert the dilator down the hypopharynx into the esophagus. Typically, endoscopist inserts his right forefinger into the mouth, keeping the tip of the finger on the tip of the dilator and directing it down the hypopharynx, with the assistant trying to extend a little bit so as to let the dilator go smoothly down into the esophagus. And as you go down to this length of 40 to 50 centimeters, you would obviously reach the stomach, and you would have dilated any of those simple strictures, and following that you gently remove the dilator slowly. And if you need to use a bigger dilator, you will try again and change it to the next size. Let us look at what happens as the dilator is going through the stricture. Here is a dilator and is a short stricture, and as you can see here, there is dilation of the stricture, and then you remove the dilator. It's a good idea to check the dilation with an endoscope to make sure there are no tears or perforations. Let us review some of the adverse events of bougie dilation. One is minor bleeding. Severe bleeding is very rare. Mucosal tears, but if they extend deep, it could be a perforation. And if the mucosal tears are severe, they may cause chest pain. I hope this is useful. And next we will talk about bougie dilation with a guide wire.